Ever wondered what it really means when someone says they have diabetes? It's a chronic condition affecting millions worldwide. At its core, diabetes is all about high blood sugar. Your body can't use sugar or glucose the way it should, which leads to high levels in your blood. That's the basic idea. But there's more to it. In this video, we'll break down the causes of diabetes and what you need to know to understand this condition better. Understanding type 2 diabetes. So what causes type 2 diabetes? It's a serious condition that affects the way your body processes blood sugar or glucose. In a healthy body, the hormone insulin helps move glucose from the bloodstream into the cells, where it is used for energy. However, in type 2 diabetes, your body either becomes resistant to the effects of insulin or doesn't produce enough insulin to maintain normal glucose levels. Insulin is like a key that helps glucose, our body's fuel, get into cells. When your body becomes resistant to insulin, or when your pancreas doesn't make enough insulin, glucose builds up in the bloodstream, leading to high blood sugar levels. In contrast to type 1 diabetes, where the body does not produce insulin and requires insulin injections for management, type 2 diabetes typically develops when the body becomes resistant to insulin or doesn't produce enough of it. What risk factors do you need to look for? There are several risk factors, and we will categorize them into 2 risk factors within your control and things you cannot do much about. Age and family history play a role in the development of diabetes, but you can't do much about them. These are not in our control. The other category, modifiable risk factors, includes being overweight or obese, a sedentary lifestyle and lack of exercise, and eating unhealthy foods. In fact, these are the big ones. You can see that making healthy changes can really help. So while diabetes might sound scary, remember, you have the power to prevent it. Let's talk about the symptoms of type 2 diabetes. What are the classical features of diabetes? You might need to go to the bathroom a lot because your body produces more and more urine. Then you feel really thirsty. You get hungry often and need to eat more and more but lose weight. That is also without trying. You might also feel tired all the time, have blurry vision, or notice that cuts and sores heal slowly. Some people get frequent infections too. But the important thing to note is that many people with diabetes don't show symptoms at first. This is something to worry about because sometimes when you develop symptoms, damage has already started to happen. That's why regular checkups are so important to catch the disease at an early stage. Now, let's move on to what can happen if diabetes isn't managed well. Complications of diabetes. If you do not take appropriate steps to control and treat diabetes, it can lead to serious problems. Some of the important complications are first, heart disease and stroke. Diabetes can increase your risk of heart disease and stroke. High blood sugar can damage your blood vessels and nerves, especially those that control your heart. Next, nerve damage, also known as neuropathy. High sugar levels can hurt the tiny blood vessels that feed your nerves, especially in your legs and feet. This can cause tingling, numbness or pain in your hands and feet. Then kidney damage or nephropathy. Diabetes can also damage your kidneys, making it hard for them to filter waste from your blood. If the damage is severe, you might need dialysis or a kidney transplant. Eye damage or retinopathy, high blood sugar, can damage the blood vessels in your eyes, leading to eye problems such as diabetic retinopathy. If not managed properly, this can cause vision problems and even blindness. Foot problems. Diabetes can cause poor blood circulation and nerve damage in your feet. This makes it easier to get wounds and infections, which can sometimes lead to amputations if not treated promptly. Skin conditions. Diabetes can make you more prone to skin infections. High blood sugar levels can cause dry skin, itching, and bacterial and fungal infections. Lastly, sexual issues. Diabetes can affect sexual health in both men and women. Men may experience erectile dysfunction due to nerve damage and poor blood flow. Women may experience vaginal dryness, reduced libido, and difficulty achieving orgasm. These issues are often linked to the effects of diabetes on blood circulation and nerve function. Managing type 2 diabetes. So how do you treat diabetes? There's no cure, but you can manage it well with diet, exercise, and medication. First, diet. Think of your body like a machine. It needs the right fuel to run well. Eating balanced meals with whole grains, lean proteins, and plenty of leafy green vegetables can help keep your blood sugar stable. Opt for whole grains like brown rice and oats, and avoid refined carbs like white bread. Incorporate lean proteins such as chicken and fish while avoiding processed meats like sausages and bacon. Fill your plate with non-starchy vegetables like spinach and broccoli, and use healthy fats like olive oil while avoiding trans fats found in fried foods. A high-fiber diet from fruits, vegetables, and legumes is also essential for stabilizing blood sugar. Citrus fruits are okay to include as they have a lower glycemic index. You need to be mindful of portion sizes to prevent blood sugar spikes. If possible, avoid alcohol, but if you do drink, limit your intake and always pair it with food. The next important thing is exercise. Staying active is also key. Walking, swimming, or biking can help your body use insulin better, making it easier to keep your blood sugar in check. Regular physical activity not only helps control blood sugar levels, but also supports overall health. Lastly, medication. Some people might also need medication or insulin to help control their blood sugar. Always talk to your doctor about what's best for you. So, what we have learned so far is that understanding diabetes is the first step. Making lifestyle changes like eating healthy and exercising can make a big difference. Regular checkups with your doctor are mandatory. With the right approach, you can live a full, healthy life. Even with diabetes, it's all about making informed choices for your health. Thanks for watching. If you found this video helpful, give it a thumbs up and share it with someone who might need it. Don't forget to subscribe for more health tips. We'd love to hear from you. What strategies have you found helpful in managing diabetes? Until next time, take care and remember, you have the power to manage diabetes effectively.